Welcome to KS Medical Coding Academy. In this lesson, we will study 2026 EM service providers and understand how different healthcare professionals participate in evaluation and management services. We'll begin by identifying the major types of healthcare providers, including physicians, residents, qualified healthcare professionals, and clinical staff members. We'll then discuss important EM concepts such as teaching physician and resident guidelines, rendering and supervising providers, and split or shared services. We'll also cover the concept of the substantive portion and explain how provider roles can affect EM reporting. Finally, we'll review surgeons, assistant surgeons, and assistant at surgery modifiers, along with CPC-focused scenarios and common coding points. Throughout this lesson, remember that correct coding depends on the service performed, provider qualifications, documentation, and applicable payer rules. Let's begin Lesson 15 and build a strong understanding of 2026 EM service providers. Before we begin, please note that this training is for educational purposes only. Medical coding guidelines may change annually. Always verify your coding with the latest CPT, ICD-10CM, HCPCS Level 2 manuals, official coding guidelines, and payer-specific policies before assigning codes. In this lesson, we'll learn how to identify the different healthcare professionals involved in EM services and understand their specific roles. We'll cover physicians, residents and teaching physicians, qualified healthcare professionals, non-physician practitioners, and clinical staff. We'll also learn the difference between rendering, supervising, and billing providers, along with the concepts of split or shared services and the substantive portion. Finally, we'll discuss surgeons, assistant at surgery services, and important modifiers such as 80, 81, 82, and as, followed by CPC-style scenarios. Remember, correct identification of the provider is an important foundation for accurate EM coding. Disclaimer: this lesson is intended for educational and CPC exam preparation purposes. Payer policies and coding requirements may vary, so always verify current CPT, CMS, payer, and official coding guidelines before applying information to actual claims. Let's begin by understanding exactly what an EM service provider is. Now, let's understand what we mean by a healthcare provider. A healthcare provider is an individual or organization that is qualified and authorized to provide healthcare services to patients. For EM coding, we need to pay particular attention to the provider who performs or participates in the EM service. The provider must have the appropriate education, training, credentials, and scope of practice, and the service must be properly documented in the medical record. Common provider categories include physicians, qualified healthcare professionals or QHPs, non-physician practitioners such as nurse practitioners and physician assistants, residents and teaching physicians, and clinical staff. As coders, one of the first questions we should ask is, who performed the service, and who is qualified to report it? CPC memory tip: provider right pointing arrow, service right pointing arrow, documentation right pointing arrow, payer rules right pointing arrow, code. Correctly identifying the provider is an important first step toward selecting the appropriate EM code. Now let's look at the different types of providers who may be involved in EM services. First, we have physicians, including medical doctors, or MDs, and doctors of osteopathic medicine, or DOs. Next are qualified healthcare professionals, or QHPs. These are professionals who have the required education, training, licensure when applicable, and scope of practice to provide professional services. We also have non-physician practitioners, or NPPs, such as nurse practitioners and physician assistants. Depending on the applicable rules, they may perform and report certain EM services. Another important category is residents and teaching physicians. Residents may perform portions of an EM service, but special teaching physician documentation and billing requirements can apply. Finally, we have clinical staff, such as registered nurses. Clinical staff may participate in patient care, but they generally do not independently report physician or QHP EM services. Brain CPC memory tip: remember, provider does not always mean billable provider. Always ask, who performed the service, and is that individual qualified to report the specific EM code? This provider identification step is essential for accurate EM coding. Now let's focus on physicians, specifically medical doctors, or MDs, and doctors of osteopathic medicine, or DOs. A physician is a healthcare professional qualified to diagnose, treat, and manage medical conditions within their scope of practice. An MD, or medical doctor, holds a Doctor of Medicine degree and is trained in allopathic medicine. A DO, or Doctor of Osteopathic Medicine, holds a DO degree and is also a fully licensed physician trained to diagnose and treat patients. From a medical coding perspective, an important point to remember is that both MDs and DOs are physicians. However, the provider's credentials alone do not determine the level of an EM code. As coders, we must review the service performed, medical record documentation, place of service, and applicable coding and payer guidelines. CPC memory tip: MD plus DO equals physician. So, identify the provider first, evaluate the documented service next, and then select the appropriate EM code according to the applicable guidelines. Next, let's understand the roles of resident physicians and teaching physicians in EM services. A resident physician is a medical school graduate who is receiving graduate medical education, or GME. Residents provide patient care while working under the supervision of a teaching physician. Resident documentation can contribute to the medical record and may help support the billed service. However, the resident does not simply bill independently for a teaching physician service. The teaching physician has an important role in supervising and participating in the patient's care. For Medicare services, specific documentation and presence requirements must be satisfied. When a resident performs an EM service, the teaching physician must meet the applicable requirements for participation in the key or critical portions of the service. The documentation must support the service that is being reported. Brain CPC memory tip: think of it as resident equals performs under supervision. Teaching physician equals supervises plus participates plus documents. For coding questions, always pay close attention to who performed the service, the teaching physician's involvement, the documentation, and the payer rules. Remember that Medicare teaching physician requirements are payer-specific, so current CMS guidance should be verified when coding real-world claims. Next, let's discuss qualified healthcare professionals, or QHPs. A qualified healthcare professional is an individual who is qualified through education, training, and applicable licensure or regulation to independently perform a professional service within their scope of practice. Facility privileges may also apply when required. Examples can include nurse practitioners, physician assistants, certified nurse midwives, and other professionals recognized under the applicable captain and payer requirements. For EM coding, a QHP may perform and report an applicable EM service when the professional meets the requirements for that specific service. As medical coders, we should not assume that every healthcare professional can report every EM code. We need to consider the provider's qualifications, scope of practice, documentation, the specific captain code, and payer requirements. Brain CPC memory tip: remember, QHP equals qualified plus authorized plus within scope. When a CPC question says, physician or other QHP, think beyond the physician and identify the qualified professional who actually performed the service. The coding sequence is: provider qualification, right pointing arrow, scope of practice, right pointing arrow, documentation, right pointing arrow, payer rules, right pointing arrow, code. Understanding who qualifies as a QHP is an important step toward accurate EM coding. Now let's discuss clinical staff members. A clinical staff member is an individual who works under the supervision of a physician or another qualified healthcare professional and is permitted by applicable law, regulation, and facility policy to perform or assist with specific patient care services. Examples may include registered nurses, medical assistants, and other qualified individuals involved in patient care or treatment. It is important to distinguish clinical staff from a qualified healthcare professional, or QHP. Clinical staff generally work under supervision and may assist with patient care. They generally do not independently report physician or QHP/EM services. A QHP, on the other hand, may independently perform and report applicable professional services when the requirements are met. CPC memory tip: think, clinical staff equals assists. QHP equals independently performs. Also remember that simply participating in an encounter does not automatically make a clinical staff member's work separately reportable as an EM service. As coders, ask 4 important questions. Who performed the service? What service was performed? What documentation supports it? And what coding and payer rules apply? Following this process helps us select the correct code and avoid incorrectly reporting services performed by clinical staff. Now let's understand 3 important provider roles in medical coding: rendering, supervising, and billing providers. First, the rendering provider is the provider who actually performs the service for the patient. This may be a physician or another qualified healthcare professional, depending on the service and applicable requirements. Second, the supervising provider is the provider who oversees another provider or clinical staff member. This role is commonly important in situations involving residents and other supervised services. The specific supervision requirements depend on the service and payer. Third, the billing provider is the provider or entity that submits the claim and seeks payment for the service. The billing provider is not necessarily the same individual who personally performed every part of the service. For CPC questions, carefully distinguish these roles rather than assuming they are all the same person. Brain CPC memory tip. R equals rendering right pointing arrow performs. S equals supervising right pointing arrow supervises. B equals billing right pointing arrow bills. Always determine each provider's role from the documentation, service performed, place of service, and applicable payer rules. Understanding these three roles helps prevent provider identification errors and supports accurate EM coding. Now let's discuss split or shared EM services, an important concept for both medical coding and CPC exam preparation. A split or shared EM service occurs when a physician and a qualified non-physician practitioner, or NPP, work together during the same EM encounter in a facility setting, and both contribute to the service. For Medicare, the practitioner who performs the substantive portion of the service reports the visit. For applicable EM services, the substantive portion may be determined by more than 50% of the total practitioner time, or by a substantive part of the medical decision-making, according to the applicable Medicare rules. Documentation is very important. The medical record should identify the practitioners who participated in the encounter and clearly support the services provided. The practitioner reporting the service must meet the applicable documentation and signature requirements. For example, suppose a physician and nurse practitioner see the same patient in a facility. If the nurse practitioner performs more than half of the total practitioner time, the applicable Medicare split, shared reporting requirements may allow the NPP to report the service. Brain CPC memory tip. Remember split. S. Same group. P. Physician plus NPP. L. Location is a facility setting. I. Involved in the same visit. T. Time or MDM determines the substantive portion. Also, do not confuse split, shared services with incident to services. They are separate Medicare payment concepts. For every split, shared question, ask, who participated? Who performed the substantive portion? Is the documentation complete? What payer rules apply? These steps will help you identify the correct reporting provider and avoid common EM coding errors. Now let's focus on the substantive portion of a split or shared EM service. For Medicare split, shared EM services, the practitioner who performs the substantive portion reports the service. For most applicable EM services, the substantive portion can be determined using either total time or medical decision-making, or MDM. First, let's look at total time. When time is used, we consider the total practitioner time for the encounter. The practitioner who performs more than 50% of the total time may be considered to have performed the substantive portion. Only distinct time should be counted. The same overlapping time should not be counted twice. For example, if the NP spends 35 minutes and the physician spends 20 minutes, the total is 55 minutes. The NP performed more than half of the total time, so the NP may meet the substantive portion requirement based on time. The second method is MDM. Both practitioners may contribute to medical decision-making. However, the practitioner who performs a substantive part of the MDM may meet the substantive portion requirement. There is also an important distinction for critical care. For split, shared critical care services, the substantive portion is determined by more than 50% of total time, rather than by MDM. Brain CPC memory tip. Remember, time right pointing arrow more than 50% of total time. MDM right pointing arrow substantive part of MDM. Critical care right pointing arrow time only for this determination. Finally, do not confuse split, shared services with incident to services. They are separate Medicare concepts. For the CPC exam, always identify the participating providers, determine how the substantive portion is established, verify the documentation, and then apply the appropriate payer rules. Now let's understand an important distinction between Captain Guidelines and Medicare rules for split or shared EM services. First, Captain provides the professional coding framework for EM services. CPT helps us understand the definitions and coding concepts used to select and report EM services, including concepts involving medical decision-making and time. However, Medicare has additional payment and billing requirements. So, a CPT guideline by itself does not automatically mean that Medicare will pay the service. For Medicare split, shared EM services, the applicable rules generally involve a physician and an NPP in the same group who participate in the service in a facility setting. The practitioner who performs the substantive portion reports the service. For applicable EM services, this may be determined by more than 50% of total time or a substantive part of MDM, according to current Medicare requirements. Documentation is also very important. The medical record should support the participation of both practitioners and the service being reported. The practitioner reporting the service must meet the applicable signature and documentation requirements. Brain CPC memory tip. Remember, CPT equals coding framework. Medicare equals coding plus payment rules. For the CPC exam and real-world coding, don't assume that a CPT guideline automatically guarantees Medicare payment. Always ask, what does CPT say? What does the payer require? Does the documentation support the service? Understanding the difference between coding guidance and payer-specific payment rules is essential for accurate split, shared EM coding. Now let's discuss surgeons and assistant surgeons, an important concept in surgical coding. A surgeon is a physician who specializes in evaluating and treating conditions that may require surgical intervention. During a procedure, the primary surgeon performs the principal surgical service. An assistant surgeon is a qualified practitioner who actively assists the primary surgeon during the surgical procedure. The assistant must actually participate in the operative service and meet the applicable requirements for assistant at surgery reporting. For Medicare claims, several modifiers are important. Modifier 80 identifies an assistant surgeon. Modifier 81 identifies a minimum assistant surgeon, when only minimum assistant services are required. Modifier 82 is used when an assistant surgeon is required and a qualified resident surgeon is unavailable. And Modifier as identifies certain non-physician practitioners, such as a physician assistant, nurse practitioner, or clinical nurse specialist, who provide assistant at surgery services. Remember that the correct modifier depends on who provided the assistance and the circumstances of the surgical service. Another important point is that Medicare payment for assistant at surgery services depends on whether the specific surgical procedure permits assistant at surgery payment. Therefore, always check the applicable Medicare fee schedule information and payer requirements. Brain CPC memory tip. Think. 80 right pointing arrow assistant surgeon, 81 right pointing arrow minimum assistant, 82 right pointing arrow qualified resident unavailable. As right pointing arrow NPP assistant. For the CPC exam, don't stop after identifying the modifier. Ask, who assisted? Did the practitioner actively participate? Does the specific procedure allow assistant at surgery payment? Is the documentation sufficient? Correct provider identification and modifier selection are essential for accurate surgical coding. Now let's review the 4 important assistant at surgery modifiers, 80, 81, 82, and as. These modifiers help identify services provided by practitioners who assist the primary surgeon during a surgical procedure. Let's start with Modifier 80. Modifier 80 represents an assistant surgeon. It is used when a qualified physician actively assists the primary surgeon during the procedure. Next is Modifier 81, which represents a minimum assistant surgeon. This applies when only the minimum level of assistant surgeon services is required for the procedure. Modifier 82 is used when an assistant surgeon is required, but a qualified resident surgeon is unavailable to provide the assistance. Finally, we have Modifier as. This identifies certain non-physician practitioners, such as a physician assistant, nurse practitioner, or clinical nurse specialist, who provide assistant at surgery services. Brain CPC memory tip. Remember the sequence. 80 equals assistant, 81 equals minimum assistant, 82 equals resident unavailable. As equals NPP assistant. For coding questions, don't select the modifier based only on the fact that another provider was present in the operating room. Ask these questions. Was an assistant actually required? Did the assistant actively participate? Who provided the assistance? Does the specific procedure allow assistant at surgery payment? Is the documentation sufficient? Also, don't confuse assistant at surgery services with co-surgeon services. These are different surgical concepts and use different coding rules. Final reminder. Correct modifier plus proper documentation equals accurate coding and appropriate payment. Always verify the applicable CPT, Medicare, and payer-specific requirements before reporting an assistant at surgery modifier. Now it's time to test your understanding with some CPC-style scenarios and knowledge check questions. Take a moment to read each question carefully and choose your answer before looking at the explanation. Question 1. A nurse practitioner independently performs an applicable EM service within the scope of practice. Which provider category best describes the nurse practitioner? The correct answer is B, qualified healthcare professional. Remember, a QHP is qualified through appropriate education, training, and applicable licensure or regulation to independently perform professional services within their scope. Question 2. A physician and NPP participate in a Medicare split, shared EM visit in a facility setting. Who reports the service? The correct answer is C, the practitioner who performs the substantive portion. For applicable Medicare split, shared services, the substantive portion is an important factor in determining who reports the service. Question 3. For an applicable Medicare split, shared EM service, how can the substantive portion be established? The correct answer is C, either A or B depending on the applicable service and Medicare rules. The substantive portion may be established through more than 50% of total time or a substantive part of MDM. Question 4. A physician actively assists the primary surgeon during an eligible surgical procedure. Which modifier identifies the assistant surgeon? The correct answer is B, modifier 80. Remember, 80 means assistant surgeon. Question 5. A qualified PA, NP, or CNS provides assistant at surgery services. Which modifier is used for the Medicare claim? The correct answer is D, modifier as. Remember, as identifies an NPP providing assistant at surgery services. Brain CPC exam strategy. When solving provider-related coding questions, follow this sequence. Identify the provider right pointing arrow, identify the service right pointing arrow, check the setting right pointing arrow, apply the payer rules right pointing arrow, select the code or modifier. And remember, do not code from the provider's title alone. Always connect the provider, service, documentation, and payer requirements before selecting your final answer. If you can consistently follow this process, you will be much more confident when facing provider and EM questions on the CPC exam. Let's bring Lesson 15, 2026 EM service providers to a close by reviewing the key concepts. First, remember the different types of healthcare providers. We need to distinguish between physicians, qualified healthcare professionals, and clinical staff, and identify who actually performed the professional service. Next, we discussed resident and teaching physicians. Residents participate in patient care under appropriate supervision, while teaching physician rules determine how applicable services are documented and reported. We also learned the difference between rendering, supervising, and billing providers. Rendering means performing the service. Supervising means overseeing the service. Billing means submitting the claim. Next, we covered split or shared EM services. When applicable Medicare requirements are met, a physician and NPP may participate in the same facility EM service. The practitioner who performs the substantive portion reports the service. For the substantive portion, remember the two major concepts, total time and MDM. For applicable services, substantive portion may be based on more than 50% of total time or a substantive part of medical decision-making, subject to current Medicare requirements. Critical care has specific time-based rules. We also reviewed assistant at surgery modifiers. Modifier 80 means assistant surgeon. Modifier 81 means minimum assistant surgeon. Modifier 82 applies when a qualified resident surgeon is unavailable. And modifier as identifies certain NPP assistant at surgery services. Brain Final CPC Memory Map. Before selecting an EM code or modifier, ask, WHO. Who is the provider? What service was performed? Where was it performed? Documentation? Is the service supported? Payer? What payer-specific rules apply? Code or modifier? What is the correct reporting choice? And here is the most important lesson. Never select an EM code or modifier based only on the provider's title. Always connect the provider, service, setting, documentation, and payer requirements before making the coding decision. If you remember these principles, you will have a stronger foundation for both CPC exam questions and accurate EM coding practice. Thank you for completing Lesson 15, 2026 EM Service Providers. Keep learning, keep practicing, and keep building your coding confidence.